If you have lasting back pain and other related symptoms, you know how disruptive to your life it can be. You may be unable to think of little else except finding relief. Some people turn to spinal decompression therapy, either surgical or non-surgical. Here's what you need to know to help decide whether it might be right for you. As we welcome one of our favorite chiropractors, he's terrific, Dr. Nick Circolone, along with Julie Carr, a nurse practitioner at Apple Physical Medicine and Rehabilitation. That looks very simple there, and you know what? The process is very simple. It's not painful, but how do you know if you need it? What kind of questions you need to ask people like yourself?
Well, you know, usually when people come in for decompression therapy, they're either having radicular pain or pain down their leg. They're having severe back pain or chronic back pain that's been lasting for periods of time. They've tried everything, and what happens is this is their last resort in some instances to actually get decompression therapy.
Now can you have decompression therapy after surgery or vice versa?
Yes. You know, right after following surgery, of course not. You have to wait a long time for the healing process, and then of course you can get decompression therapy.
Julie, it's great to have you here, a nurse practitioner. What do you see for your patients? Right now, Dr. Circolone in his practice not only has a physical therapist, also a nurse practitioner. The entire body is taken care of here. It's a one-stop shop. So what are your recommendations for this kind of therapy?
You know, it's really a great collaboration of things that we do, all three of us together. But this is really, I haven't had any experience with chiropractors in the past, and what I've seen with decompression therapy is really amazing.
Let me ask you, how do you know if you're getting the wrong kind of treatment? I mean, some people will put you on treatments that'll last for months and months and months. How do you know you're getting well, Dr.
You know, everybody's dynamic. Things are changing, and that's the beauty part about having Julie with us, because it's medically supervised too. Not only supervised by the doctor, but it's also medically supervised.
So explain what we see here.
Basically, what the patient is doing, they're laying in a prone position, and what happens is they're strapped in, and we use linear traction to pull apart the vertebra to decrease the tension that's in that area and give space for that nerve, let the disc kind of heal and go back into place. And this process takes some time, but if you're getting better, you have to sit back and say, okay, am I getting better? What else do I need to be doing? So we do physical therapy and modalities, we do manipulative therapy, we do rehabilitation, all of this to help stabilize that area and get people out of pain. It doesn't take that much pressure to cause pain, and it doesn't take that much pressure to take away the pain.
So you as a patient have got to do a lot of work yourself. Whether
Absolutely.
It's working out, whether it's building that core, which you've always stressed, you've got to do some work as well.
Absolutely. One of the things that we preface with our patients is, if you're going to go through the decompression therapy, if you're going to spend the time, if you're going to spend the money, you need to start doing things for yourself. You need to start exercising. This is not a cure-all. It's something to get you to where you need to be to get better, so you can strengthen your body, so you can feel better later on.
This machine that we were showing there in this video, you have that as well?
Yes, it's called the DRX 9000. We actually have several machines in the office. That's one of our flagship.
Very expensive machine. Now, you need to do your research and find out, look, this is the top line of machine. Understand what your doctor is using. Be the consumer shopper here.
And one of the things is a lot of people don't realize that in our office, this is a procedure that's covered in our office because of the medical, because of the physical therapy, because of the chiropractic, and all the other things that we do with it.
Julie, you're a nurse practitioner. You were going into school. You never probably thought about working in a chiropractor's office, but you know what? People want the one-stop shop these days. They want this type of therapy. They want to know that they can go to a medical, they can go to a doctor, then they can go to a physical therapist, and they can go to a chiropractor. They need the help. This is what it's coming to in our society.
It has really been great, and even the patients are very receptive to it, for sure.
And you've also got the physical therapist.
Oh,
and,
yes.
I think that's great, because you can always pass it on to a physical therapist, so the therapy can continue.
Well, you know, one of the things I did want to say about the decompression therapy and physical therapy, Dr. Dooley's a neuro...
Who is the physical therapist?
Yes, he does electrodiagnostic therapy. He's fellowshipped in electrodiagnostic therapy. So what we could do is we can actually do an EMG to find out if there's any nerve damage prior to putting a patient on one of these machines. And if there's no nerve damage, we can see how they progress without the pain. And if there is some nerve damage, we can see if there's been any improvement by doing a follow-up EMG.
Of course, you have gone on, got an additional degree.
Right, in chiropractic orthopedics.
3 years to do. You've got the respect of the orthopedic community here. Why would an orthopedist send someone to a chiropractor?
Because there's a lot of times that surgery may not be what they need at that moment. This may help them and prevent surgery or prolong surgery.
You've always said nobody should have to live in pain.
No, absolutely not.
So good to have you here.
I appreciate
Dr.
it.
Nick Circolone. It's great, Julie. It's always a pleasure to have you. Dr. Nick Circolone and his staff, Apple Physical Medicine and Rehabilitation. They're Shallowford Road, right near the Hamilton YMCA. There's the number, 855-7376. And folks, if you work that first shift, he's open at 6:30 in the morning. I love saying that because I get up at 2:45. 855-7376. Stay well. Nick Circolone, thanks so much. I'll see you tomorrow at the Spark Clinic.
I'm so excited about that.
It is a ski clinic for people with physical disabilities, and you are in the water for like 10 hours.
We'll be in the water for a
entire
while.
time. We're back after this.